There. Let's see how this lighting is here. So hello, everybody. Good afternoon. Let's see how this light is. Maybe here it's better. So good evening, everybody. So if you are new to my page, I am Angel D7. So I am tonight discussing chronic kidney disease and what it is, what causes it, and what we can do to prevent it. So I do want to wait for a couple more people to come in. Let's see if I can tag. Let's see. Tag. All right, so I got just sending out some invites to different ones that might want to join my live or to see my live. I am tonight talking about chronic kidney disease. What is it? How it works? What we can do to prevent it? Answering any questions that anyone might have. You're welcome to say hey if you're gonna stop by. Say hey, and I'm just sending out invites to all my friends. So if you get one and you just join, like, what did she talk about? I am talking about chronic kidney disease. Again, what is it? And just to tell you about my experiences with this illness. I'm sorry, still inviting. So if you have any questions for me, definitely put your questions inside of the chat and I'll be happy to answer any questions you might have. So again, I am Angel D7, Angel by you'll know me by Angel, of course. Plenty of people know me. Sorry, trying to get this right. So just to tell you a little bit about myself, I recently was diagnosed with chronic kidney disease, and CKD for each individual is different, right? So chronic kidney disease is basically any disease of the kidney, right? Some people get chronic kidney disease from having diabetes. Some get it from having high blood pressure. Some people get chronic kidney disease from sometimes when you have like a really bad infection in the body. It can cause your kidneys and your other organs to be affected by it, especially your kidneys. Mine is a little bit different. You can also get chronic kidney disease from a predisposed genetics, just something that you're born with. It's not so much just to be born with it. But it's a gene that has caused some weakness in your kidney. Basically straight the kidney. Your heart is not affected by it. Your lungs is not affected by it. Your other organs are not affected by it. But this particular gene, which is called, the gene that I have is called APOL1 gene. Again, that is a APOL number 1 gene. This particular gene is a mutation from direct descendants of Africa. So, of course, you know my beauty. We trace the gene back to, it is directly from Africa. The way that it was explained to me was that at some point, people in Africa got some whatever virus at some point, and this gene mutated in order to protect them from that particular virus. I forgot the name of it. And because it mutated, this APOL1 gene is found in people who did develop that mutation of that gene, but it causes a direct hit to their kidneys. Okay, so some people have this gene all their lives and not have any problem. Okay, other people, you'll see that it runs in their family. Like in my family, I had my baby sister had chronic kidney disease. My brother Lonnie had, I'm sorry, I said his name, but my one brother and another brother had chronic kidney disease. Now, which side of the family did it come from? Mom or dad? We don't know. We just know that it is a gene that is carried by my immediate family. Now, does my children have this gene? I don't know yet. We don't know yet. We don't know if they carry it. We don't know if my grandchildren, I'm sure that some, at some point, some of them may have the gene. Now, it may lie dormant in them until, again, they may get an infection, and then this gene, because it's in them, may cause them to have a direct problem with their kidneys. So that is how I got on my journey. So I guess about 7 years ago, when I began to see a decline in my kidney function. So the first thing people ask is, well, what symptoms did you have that made you say, I might need to see a doctor? Me personally, I had in something so common, something so simple, it was my foot was swollen. Not the entire foot, just on the top of my foot, Didn't think nothing of it. I thought I hit my foot on something, and I went to work limping. Of course, I worked at a doctor's office at the time. Went to work limping, and the nurse's practitioner saw me, and she asked me like, hey, why are you limping? And I was like, well, I think I hit my foot. Maybe I slept wrong. Maybe something bit it. I don't know, an ant, whatever. I don't know. I didn't think anything of it. I kept continuing on my day. But then she spoke with the doctor there on site and said that I probably would need to be checked out. So the doctor asked for me to meet her in one of the rooms, and she looked at my foot and noticed that there were no bite marks. There were no signs of that it had been, bumped, bruised, hit, anything fell on it. But it was swollen, just a little swollen, a little swollen. So she said, well, what I'll do is I would like to have some testing done on you. And I'm thinking to myself, I don't know what the test is going to be about, but okay. So she ended up doing testing and found that my creatinine level in my blood was elevated. Creatinine. I think it's creatinine. Creatinine is the level that was elevated. Also, my GFR was elevated as well. Well, actually, it was going down. GFR goes down, creatinine level goes up, and that's just how they work. So after that, I think I was at a maybe like CKD number 2 at that time. 2, I think, is right at when your creatinine level is right at about, it's about 2, between, creatinine level would be about between 2 and 3, if I'm not mistaken. I can pull up the stats, but somewhere in there, I was at a level 2. So she said that she recommended that I see a nephrologist, and I did. So whenever you go to see a nephrologist, the nephrologist will do all kinds of exams because they're trying to figure out, like, do you have polycystic kidney, these kidney, like it's these little lesions on the kidney, or is any kidney cancer? Do I have any of that? And of course, there was none of that. So I ended up doing a biopsy, kidney biopsy. I did blood work, of course. They also had me to do a CAT scan. At that time, an kidney ultrasound. With all of that, that just said, they just saw that there was something that was causing, they could not figure it out though. They wasn't sure exactly why my kidneys were doing what it was doing. They just know that I had a family history of it, and whatever is going on is causing this damage to my kidney. So we continued to treatment. I began on a healthy diet and de-stressing my life, making sure that, because stress is a big factor when it comes to your kidney care. What advice I can give anyone out there that is under a lot of stress, and a lot of mothers are under a tremendous workload, home load. We've got children. We have church life. We have our personal life. We have all kinds of things that weighs on us as mothers. However, we have to take care of ourselves. There's no way around it. We can work ourselves, push ourselves so far to the very brim of sickness. We have to take care of ourselves. So I started, when I say de-stress my life, sometimes you have to say no to a lot of things that you normally or commonly say yes to. Sometimes you have to get someone else to do the heavy lifting, and just give yourself a moment, take a break, take a breather. But I continued my journey as far as being CKD 2, and this was back in 2000 and I want to say about 2000 and this is 25, so yeah, 18-ish. And I was doing good. Actually, I went on a juicing fast. I lost about 50 pounds. I mean, I was looking good. And I was feeling good. My labs and my results showed that I was on my way to healing, to getting better, feeling better, doing better. So then my doctor said, well, you're stable. Don't worry about anything. Just keep doing what you're doing. And I did. Until. There's always an until. Praise the Lord, Sister Anita Brown. Good to see you. Hey. But so until COVID happened. So the way that I first got COVID was my brother, one of my older brothers, had passed away in August of 2020. I believe that was August, yeah. And I went out for the first time since COVID started to go and pick out a suit and to help get things arranged. The one day I went out, the one day I went to the mall, the one day I got COVID. Now, for me, I was not vaccinated at all. I had not gone through any vaccination process or anything. So it hit hard, very hard. Praise the Lord, Sister Betty Baker. So good to have you on my live. Yes, ma'am. Y'all are welcome to ask me any questions or comment at any time. So I got COVID. I went through about 3 weeks. I got through COVID. However, my creatinine level jumped from 2. By the way, there are 6 stages of CKD. There's 6 stages. People know about 5 of them only because one stage, there's 2. So you have stage 1 when it's a little elevated. Stage 2, as I mentioned, creatinine levels about 2, gotten up to like between 1 and 2. Then there's stage 3A, stage 3B, stage 4, and then stage 5. So 3A and 3B are stages of CKD. So there's actually 6 stages of chronic kidney disease. So after I got COVID, my creatinine level skyrocketed. It was no slowing it down. I mean, it just every month I went to my nephrologist, it was up a few points, up a few more points, up, and there was just nothing I could do. So once I got to my nephrologist, he said, well, I don't know why your kidneys have not failed, and I don't know why they have not gotten better. All I know is at this point with this nephrologist, his final result was, if you get in pain, go to the hospital, tell them to put you on dialysis. That was his final word to me. That was his final word because that was the last time I saw him. I moved from that doctor, nephrologist, and went to another nephrologist who did a full workup on me. And that particular nephrologist went back to the drawing board. He did not do a new biopsy. He did not do a new ultrasound, but he did not do a new CAT scan. He, however, did a blood work. He also did some genetic testing on me. He also had me to go and have a PET scan done. That was one of the scariest tests I think I've ever had. I've had an MRI before, but that PET test, that PET scan, that test is, it's very closed in. I used to schedule these exams for other people, so I know how all of these exams work. I worked for a local imaging, radiology and imaging company. So this particular test, if you've ever had an MRI, you know that the MRI is open on both sides. It's like a donut. So your body goes through the donut hole. Well, the PET test is more like a tube. So your body is enclosed in like a donut shaped hole, and it's more tight. It's more tighter. Praise the Lord, Sister Clay. So good that glad you joined my live. Praise the Lord to everybody. So we're just talking and chopping it up about, thank you, sweetie, about chronic kidney disease and my journey. So if you want to stay, that'd be great. So with the PET scan, went through that. The PET scan resulted that there was nothing shown, no cancer. So PET scans are basically, when you have those done, they're primarily looking for cancer. They're looking for something that is causing the issue with your body. Well, they found no cancer, nothing that would contribute to their answers on what's going on. So with this new nephrologist, he says, well, We did get the test, the genetic test back. That's who discovered that the culprit in my family that is causing problems with our kidneys is the APOL1 gene. Okay, so that's A as in apple, P as in Paul, O, the number one. I'm sorry, APOL number 1 gene. That is the gene that is causing kidney failure in my immediate family. Okay, and I like to get that out to people, because a lot of people, and especially in my family, they don't know that we carry this gene. They do know that there's something amiss in our genes, but they don't know what to call it. What is the name that I should be asking my doctor about? What should I be looking for on my blood work whenever I get it every year? What should I be doing in order to prevent or avoid going down the same path? Okay. So that's why I'm here. If I can be not a test dummy, but if I can be the person to bring awareness to what's going on, and this may be something that someone else it could be helpful for them when they go to their doctor and say, well, check my kidney. I need to know how my kidneys are doing. Of course, all of your organs, your heart, your lungs, your kidney, you know what I'm saying? You want to look at all of that, but I'm just talking about at this point, the kidney. So I am continuing the journey with CKD, but with the new nephrologist, he was very helpful. I thank God for him. He broke things down for me in a form that I can receive it and I can understand what he's talking about, So went from there, and after I had COVID, he did went through that process. So now when I get to him, I'm at a stage 4. So I jumped from 2 to 4. 3A and 3B was not even it wasn't even a speck on the wheel. It just was like 2. I went through 3 at some point, maybe when I had COVID, and went straight to 4. Now I'm at stage 4. Again, I told you there's 6 stages, but I went through 1, 2, 3A and 3B already gone. So now I was at 4. So there's only one more stage to go before I had to make a decision. So my nephrologist says, well, you have the option. At this point, we have to talk about it. You have the option of going on dialysis. You have the option of going from being how you are now, how I was then, to directly to a transplant. Didn't know that you could do that. I thought you had to be on dialysis before you would even be considered for a transplant. But I found out that is not the case. As long as it shows that you have significant kidney damage or loss of function, you can get a kidney transplant. However, I wasn't trying to hear that. I wasn't trying to hear dialysis either. So ultimately, I had to make a decision though. So, going through all of that, fast forward to last year, I finally had to make a decision. So, of course, I said, well, let's go with dialysis for now, and I'll get on the transplant list. All right. So let me explain. Soon as you hear, most people hear dialysis, they think of a death sentence. So you're going to be just no good for nobody. Well, thank God that I know who Jesus is. So there are 2 different dialysis. Don't know if everybody knows that, but there are 2 ways that you can go. You can either go with hemodialysis, HEMO, which if you look up hemo in the medical dictionary, that's blood, right? That has to do with the blood. That's traditionally where you go into a center, you sit on a seat, they inject 2 needles in your arm with the fistula, and then the one brings the blood out, it cleans it, and then the other one takes it, puts it back into your body. That's what hemodialysis is. Usually 3 times a week. It's a very harsh dialysis on your body. Most people who are on hemodialysis, they need to recover. Takes about maybe sometimes 1 to 3 hours just to recover from a 3-hour visit. So they're drained, they're tired, you know, they just need to recover. So I did not choose the hemodialysis. I did choose to go with the peritoneal dialysis. So most people will refer to that as home dialysis. Okay. So peritoneal dialysis is where there is a tube that is placed in your abdominal area that goes to your peritoneum. That's an area in your body, just a space that's in your body, where the fluid and toxins can cross the blood barrier. So it goes from that where the tube is placed. You will have fluid going into your abdominal area, usually about 2,000 milliliters. Just imagine 2,000. And it makes you feel really full, really full. And that fluid sits there for about an hour and a half to some people, or an hour and 45 minutes. It sits there. After the hour and 45 minutes, hour and a half, then it is drained out into your tub, into your toilet, by way of the process of this tube that goes there. You go through 3 to 4 cycles of that in one night, in one treatment. So every treatment you have, you go through 4 of those cycles. And then you wake up in the morning, you unhook, and you are done. Okay? So that is the peritoneal dialysis. Now, peritoneal dialysis is not one for anyone who is not comfortable in taking care of themselves. If someone feels that this is something that a doctor should be doing, this is something that I just want to just go into a clinic, sit there, let them do what they need to do, and I want to be on my way, then absolutely this is not for you. Peritoneal dialysis is a gentle dialysis. When I say gentle, which means that to your body, this is the most gentle that any, of the 2 dialysis options. It allows me to still work. When I'm up in the morning, I am refreshed. I just about sleep through the full treatment. I just wake up to check to make sure everything is flowing smoothly. Then when I get up in the morning, I just unhook the cable. And I'm going to show you guys in my next one. Right now it's 8:29. So this live is probably going to go into 8:45, about 15 more minutes, and then I'm going to cut it. But in my upcoming lives, I would like to show you my machine. I would like to show you the actual catheter. If you can stand to see it, it's not bad at all. Or I'll show you a picture or something. But it is very interesting. Science has come a long ways. Now, from what I read up on, peritoneal dialysis has been here since the 1960s. I think that it just was maybe not available to as many people as it could have been or something. I just don't know, but I know the hemodialysis is the first choice, the first option for people. They don't even think about, is there something else that I could do? Is there another way? And that other way right now, according to science, and according to what is available, is peritoneal dialysis. I am all for peritoneal dialysis. If there's someone that is interested in knowing more about it, I can give them firsthand information. So the process, it is an outpatient procedure. You go into the hospital in the morning, the normal prep for any type of surgery. You are put to sleep. It is an actual surgery. They put you under. I think the procedure probably takes about a good hour, and then you're done. You come out of the hospital. Of course, anesthesia has to wear off. And yes, there is some pain, with any type of time you go under any surgical procedure, there is some pain with it. So you come home, and then you have to get used to having this catheter in your abdominal area. It does feel funny at first, because it's like, what? Like, my body's like, nah, this is not supposed to be here, and so I changed my own bandages. I am a type of person who likes to take care of myself. I need to see how can I help myself. I changed my own bandages, clean the area, clean the wound, and just continue to do everything I'm supposed to do to help it to heal. Again, I will go over everything. I want you to see the machine. It's not a bad machine. It's not like a chair. First thing someone thinks of dialysis at home is that you got this big, gigantic chair that comes home with you, and you're sitting there, and it's hemo. It's not hemodialysis. This is peritoneal dialysis. So let me just say this. Although I am in CKD 5, my kidneys still work. Okay. I know people think, well, dialysis means that they don't work anymore. That is not correct. Dialysis means that your kidneys are not functioning to a level that would allow your life to be sustained without some help. So dialysis is to be a help. I think that's what hemo was supposed to be, but it's more of a pacifier. It's just a Band-Aid that they put over a big cut. It's just gonna slow things down just enough for it not to spill out, So my kidneys do function. They're just, I think I'm at, right now, my kidneys are, last I checked, he told me I'm functioning maybe at a 7%. No, not 70, 7%. So what that means is that out of 100%, I am 7. So I don't know if that's right. Yeah, 7. Out of 100%, I am 7. If we was in school, 7 would be failing. So look at it at the same way. If your creatinine level is at 100%, would be, I think, a 0.78 is what it's supposed to be. That's like a normal level for creatinine level. 0.78, below 1.0. So my creatinine level right now is at a 6. So that says that I got some serious things going on. So that's why I needed some intervention, right? So yes, I have started my treatments. I feel a whole lot better. Oh my gosh, I feel so much better. I thank God for that. Another thing that comes along with CKD, symptoms. People always ask me what were my symptoms like. I don't know why sometimes we are scared to go to the doctor. Why we're scared for them to check our blood. I don't know why. When there's some things we need to know. Okay, I would even if I know that a family member of mine have they have APOL1 gene like I have it. And if I didn't know if I'm a cousin, if I'm a niece, if I'm a nephew, and I'm getting my yearly exams like I'm supposed to, I would actually ask my doctor, hey, I have an aunt who, or I have a, sister, I have a, they have been diagnosed with having the APOL1 gene. And I would like to know if I have it. They have a test that they can do. You just have to have them to do the test, but you've got to speak up on your own behalf and ask them for the genetic test to verify if you have this gene. If you have the gene, then you need to be aware of what that means for you and for your kidneys. It's just as simple as that. If a lot of us are more aware, then we could slow the progression of kidney or chronic kidney disease down. We can slow it down. We can make lifestyle changes. Check your blood pressure, making sure that your blood pressure is never elevated to the point that it will aggravate that situation, or it could be dormant in you. It could be dormant, and then as soon as something happens, like I said, you get high blood pressure or something, it can wake it up. Once it's woken up, it's like it's just one hurdle after another hurdle after another hurdle. So what I want to do is get the word out. I want people to know that, listen, and the thing about the APOL1 gene, it is predominant in the African American race. This is not something that our white counterparts have. So don't think that, oh, well, no, it is an African American. Hands down. That's it. Only way that our white counterparts would have it if they were mixed with black. So what does that say? Go and check your blood work, Stop being afraid to ask the doctor for a copy of your own blood work. You're paying the bill. You're paying for your doctor's appointment, your annual exams. You're paying for all of this. Why don't you have a copy of what they got? I mean, just to keep a record and see what your creatinine level is. So again, it is creatinine. Once you get your blood work, look at the creatinine level, watch it. If it goes above 1, and your doctor is telling you don't worry about anything, and you know that you might have a predisposed, hey Brenda, how are you, sis? Good to see you. Well, good to hear from you. But if you have a predisposed something going on in your family or whatever, and you see that your creatinine level has gone up past 1, don't let a doctor tell you that you're okay. Don't worry about it. Why would you not worry about it when you already know that you have some things that your other family members have seen? So of course you should bring some attention to that. I'm great, Brenda. I'm great. Yeah, so we're just sitting here chatting about health, chronic kidney disease. I'm currently dealing with that now and going through the process of peritoneal dialysis and answering any questions anyone might have. So I've got about another 6 minutes. If anyone have any questions for me right now, I will be happy to answer questions. I know that some people just have a lot of questions about symptoms. I want to say this. One good thing that has happened. Yesterday, I went to my nephrologist, and I told you I've been doing my treatments. My nephrologist actually took me off of all medications. So, yeah, I don't take any medications for anything. So, so let me just back up. So the treatment is a medication. but I don't need to take any blood pressure medication. No, no iron anymore, because one big factor with having chronic kidney disease is because your kidneys actually make red blood cells. It can cause you to be anemic whenever your kidneys are not functioning well. So anemia is a big part of CKD. Okay, this is before I started treatment. Okay, so whenever you have CKD, that's one of the big things that you will encounter. You may encounter. Let me say that you may encounter is becoming anemic. Being anemic, of course, carries its own set of symptoms. The tiredness. You just don't want to get out of bed. I work from home, but I would work from home and turn over after I get off, just roll right into bed some days, cover my head up and go back to sleep. Didn't want to be bothered with people. You have, you can have depression, from, CKD, along with having anemia. It's just a lot of symptoms that a lot of people, these are common symptoms for a lot of people. So, but, yeah, so that's what, I want to definitely talk about, get the word out about. I would like to see if I can help anyone who might have questions about these things, so they'll better understand that this is not, having chronic kidney disease is not a death sentence. It's not saying that, oh, you're not going to be able to make it through. You can make it through. I know God's going to do something for me. I don't know what, but I'm waiting. I'm patiently waiting. But in the interim, I do want to educate people if I can answer any questions. But my next live will be on next Thursday. Next Thursday at 8, I'll do another live. Now that live, I would like to go ahead. I want to show you guys the machine that I use and discuss the process of using it just for educational purposes. But like I said, it's a lot to discuss. If you do know somebody with CKD and they're going through right now, before they even have gotten to the level of CKD 5, just remember that they are going through a lot. It's a lot. You battle with it. It's not something that is easy. I'm feeling better. I thank God for that. But trust me, I've gone through everything that they have gone through, from stage 1 to stage 5. And it's not easy. A lot of days some days are easier than others, and you can muster through, you can push through like we often do. But just remember that, whenever they're going through it, just because they're not on dialysis yet, don't mean that they're not going through something. So be aware that whenever you just have CKD, chronic kidney disease, anything over just a normal kidney function, your hormones are affected. Your, like I said, being anemic is very common. I don't know if they may have some other underlying condition. For me, this is the only condition that I battle with. So I don't have diabetes. I didn't have high blood pressure before I had kidney problems. It's like my kidney problems triggered my high blood pressure, my pressure to go up, because again, the kidneys are here. The adrenal gland sits on top of the kidneys. So once one's affected, the other's affected. So it's just how it works. I just would recommend that also that anyone who has not gotten their yearly and annual exam, to get one, and to get a copy of your results. Keep them, go through them. If you have to Google to see what the normal range is, do that. Discuss it with your doctor. If you see something that is elevated, if you see something, say something. It's your body. And if you don't do anything about it, nobody else will. And the doctors will just turn their head and say, well, wait till it get way out of control, and then you might have a response from the doctor. That's not fair. As soon as you see it elevated, you do something. You say something. If that doctor isn't doing anything about it, change your doctor. So that's it. My live is ending. I want to tell you all thank you for joining me on my live. Next Thursday at 8, I will return and get further in depth with you. I love you all. If you have any questions for me, please reach out to me through my inbox, and hopefully I'll have more information and content for you soon. Take care. I love you all. Have a great night. Bye.